Pain in the lower back can be debilitating, and worldwide affects the lives of over 500 million people every day. If you've tried conservative treatments like physical therapy, medication, or injections without success, spinal fusion surgery may offer relief. Traditional spinal fusion surgery can be a major operation with a long recovery, but with robotic-assisted, minimally invasive transforaminal lumbar interbody fusion surgery, the recovery process can be quicker and the outcomes better. TLIF surgery is a spinal fusion technique for the lower back, in which two vertebrae are joined by removing a portion of the disc and inserting a spacer. Removing the disc and fusing the vertebrae eliminates pain-inducing motion and reduces compression in the surrounding nerves to alleviate sciatica and back pain. A robotic-assisted, minimally invasive TLIF surgery achieves greater precision during the procedure, causing less damage to the surrounding tissues. The surgeon uses a robotic arm to guide the surgical instruments and implants, allowing for much smaller incisions, reduced blood loss, shorter hospital stays, less pain, and quicker recovery times. With greater precision and accuracy during the procedure, the surgeon can achieve better alignment and fusion of the vertebrae, which can lead to a better overall outcome for the patient. If you or a loved one are considering spinal fusion surgery, be sure to discuss the benefits of a robotic-assisted minimally invasive TLIF surgery with your doctor. Contact Longhorn Brain and Spine at 682-337-7463 or visit our website at longhornbrainandspine.com.